My name is Dr. Ali Khan. As a former primary care doctor and now as a hospitalist, I'm acutely aware of the difficulties of directly admitting patients from the outpatient setting into the hospital. Currently, the process is extremely frustrating and time-consuming because each hospital has a complicated internal admission process. Because of this, we were forced to send our patients to the ER, where critical time is lost and healthcare dollars are wasted. That is why we developed DASH, Direct Admit System for Hospitals.
DASH streamlines the process for directly admitting a patient into the hospital. Any clinician or their staff from an outpatient facility can click the DASH app or the DASH button, which links to an easy-to-use direct admit form. After entering the pertinent patient data, they can also upload additional electronic medical records and place admitting orders. From the DASH app, the admitting physician accepts and the bed coordinator assigns a bed. The patient then receives a hospital boarding pass confirming room number. Upon patient's arrival, the doctor and nurse are alerted to commence care.
Probably one of the greatest advantages of the DASH system is that I can access the admission process in a much more timely fashion. At one time, if a patient came into my clinic who needed the services of a hospital, I had a couple of options. One, I had to stop everything I was doing, write out a lengthy set of orders, contact a housing supervisor, and an accepting physician. The other option I had was to send the patient to the emergency room, which is something that we frequently do, and sometimes it leads to unnecessary delays in their care and a lot of waiting in the waiting room. With the DASH system, I can simply log on, I can provide their information, their basic needs, and their basic orders. Generally, within 60 seconds, I have an admission number, and I have something that I can give to the patient to direct them straight to the hospital. This gets them to a hospital bed and gets them the attention of a hospitalist in a much more timely fashion.
As a house supervisor, the DASH system is a great time saver. It allows us to receive orders, requests for admissions, all through a computer, and it eliminates us having to make multiple phone calls about one admission.
As a hospitalist, DASH has turned out to be a very useful utility for myself and other physicians who have had the opportunity to use it. It has basically streamlined the entire process of transferring patients from outside facilities to the hospital. Overall, this has made the process much smoother and more efficient for the hospitalist and accepting these patients, which otherwise normally can be potentially a very difficult process.
Hi, my name is Craig Saltonfuss. I'm the Director of Business Development for Conroe Regional Medical Center with the HCA Gulf Coast Division. When I hear the word DASH, I get really excited, especially since I'm in business development. I just have seen DASH as we've rolled it out into our market. I've just seen what it's done for our hospital and our facility, how it's really transformed and revolutionized direct admissions. It has absolutely helped just more to expedite the process, just make it a more streamlined, just a more efficient process getting patients admitted to our hospital. The other thing that DASH helps to do for our hospital as well too, we really utilize and leverage the tool to identify new opportunities in the marketplace. That is something that gives us a competitive advantage. We're able to go out there and visit with freestanding EDs, urgent cares, referral bases that are not necessarily as loyal. And because it's such an easy process to get their patients admitted to our hospital, they're certainly giving us a shot with DASH. So we're seeing an increase in admissions. We're seeing certainly increase in volumes. You know, it's a win for all involved. Again, it's a win for our hospital, our referring physicians, and most importantly, our patients. We want to make sure their experience is the very best it could be at our hospital, and the components and functionality of DASH, that tool really helps to contribute towards that. So we're just ecstatic about the program. The DASH does so much for our hospital, it does so much for our patients. Anytime we have conversations in our hospital about DASH, there's a smile on our face. From the facility perspective, we have an increase in volume. We have patients that are even happier when they arrive. We have physicians that refer to us that are even happier. Everybody just typically seems to be happier with the process, the direct admit process with DASH and our facility. When we're out visiting other physicians in the marketplace, we bring up DASH during our visits. They smile. They tell you how much they really appreciate the program, how easy it is to use, how much their patients appreciate the experience at our hospital. So everybody's smiling with DASH.
As you have heard, DASH has revolutionized the direct admission process. So avoid the frustration. Use DASH to get your patients the attention they deserve.